A lot of my research focus is on young people who develop colorectal cancer. Recently, my team and I published a paper that shows that people who live in urban areas do better than young onset patients who live in rural areas. And there's a lot of different factors we think about. Is it access to care? Is it just health literacy? They're not seeing, obtaining medical care at, a normal or as easily as other patients and do. So there's a lot of different things. A lot of our research has focused on trying to identify those potential disparities, whether it's, based off the patient's, ethnic background, whether it's their income level, whether it's based on sex differences, and all those factors can play a role into young people developing colorectal cancer. And one of the things that we hope to do by putting out the data and doing our research is to increase awareness of it and hopefully make everybody aware that this is a rising problem and we need to take it seriously and work to try and improve outcomes and just help these patients in general. Across the board in all GI cancers, our poster at ASCO this year was based around young people, the AYA population, which is 15 to 39-year-old, and looking at what the trends are in terms of their survival and which cancers are rising at a higher pace. And we see multiple cancers are rising more dramatically, one being pancreas cancer in that population, one being stomach cancer. Small bowel cancer is also increasing at an increasingly large rate. Across the board, we know in that population, both in colorectal cancer and essentially amongst GI cancers as a whole, the incidence does appear to be upticking, and there are certain factors that may be contributing to that. Is it their time to treatment? Is it, certain sex-based differences? It seems like males may be more prone to have a worse outcome and results, less, the longer it takes to treatment. So if you have longer to start your treatment, that obviously makes sense as a risk factor and a predictor of worse outcome. One of the things we are seeing that's a little bit different than colon cancer is that these patients and other GI cancers are actually doing better than their average or older age counterparts, which is a little bit of a departure from colorectal cancer, but that is amongst all the cancers. So one of the things that we plan to do when we write up our paper on this is to tease out the survival based off of each individual cancer. One of the most often questions I get is, what are you seeing in terms of, is this genetic, is it hereditary? And the difficult thing and somewhat scary thing is that the large majority of early onset colorectal cancer is sporadic, meaning there's no clear inherited reason why you're getting colon cancer. And I think that more people have what's called left-sided colon cancer, and that comes with it a certain molecular profile. But I think that is a clear trend that we see, is that a lot of these patients with, at least in colorectal cancer, have tumors on the left side, so colon and the lower colon and the rectal area is where we're seeing the biggest uptick in early onset colorectal cancer cases.